All right, the recording has officially started. Welcome to all of you who continue to sign in to tonight's workshop called The Truth About Shoulder Pain. My name is Troy Vander Molen. I am extremely pleased to have you with me tonight. I know that your time is limited and valuable, and that means that if you've chosen to give me some of that time, shoulder pain is probably a reality for you that you'd like to make a part of the past instead of part of your present. And so that's what we're going to talk about tonight. Let me share my screen. And you're going to see my lead slide here called The Truth About Shoulder Pain. As I was just saying a little bit before I started the recording, I can't see you, I can't hear you. So it requires for us to have any kind of interaction, a little different approach. Prior to COVID, we did a lot of these workshops in person. Really easy to be interactive during that kind of a session. Not as easy to do that in this session, but we can do it. So I want to encourage you to click on that chat button tonight. If you click on that, type in that message box, any questions that you have. I promise I will either get to it right away, or because we got too much stuff going on and I can't get to it right away, I will definitely get to it after tonight's session for sure. So please do that. I want to be a resource for you, make sure all your questions get answered. I'm also going to give you my contact information tonight too. So if you, after the fact, if you're thinking about the stuff that you learned tonight and want to ask more questions, you can reach out that way too. Why in the world would you want to listen to me? Well, let me tell you a little bit about myself. I've been around a while. Half of my life, I've been a physical therapist. After graduating about 25 years ago from the University of Iowa's physical therapy program, proud to be a Hawkeye graduate. That program is consistently ranked as a top 2 or 3 program in the nation. And so I feel blessed to have gone through that, and it prepared me greatly for my career as a physical therapist. But that being said, what you're going to learn tonight are things that I've learned in the trenches from doing this type of treatment, type of care, assessments, evaluations, and treatments with people just like you who have been dealing with shoulder pain. And that kind of experience is really, really helpful because it's allowed me to cut my teeth and figure out what works and what doesn't work. I've been with Kinetic Edge Physical Therapy now for about 21 years. The company itself started in 1998, and I joined it about 3 years in. Right now, we have 7 clinics in South Central and Central Iowa, from Ames in the north through Des Moines, and all the way down south and east to Oskaloosa, Pella, Centerville. In those clinics, I have 24 other physical therapists that work with me, as well as occupational therapists and a variety of assistants. We all see a ton of this stuff. In fact, shoulder problems are the #2 reason that people come see us in our clinic. In fact, I did a little research. It's been a little while ago, so I don't remember exactly, but I believe in the past 3 years, we've done over 20,000 visits with people dealing with shoulder pain. So with all that experience, you learn a ton. And at our particular clinic, Kinetic Edge Physical Therapy, our approach is a little bit different because we see and analyze and help people move 3-dimensionally. It's called 3D maps. The reality is your shoulder is made to move and work in certain ways, but it, like everything else, is a 3-dimensional mover that operates between gravity and the ground. And so getting your shoulder to do the right thing at the right time, we take for granted when that happens very naturally. But when we have pain and problems, we don't take it for granted anymore. And our approach using applied functional science is to teach that shoulder how to collaborate and cooperate really well with everything around it. So you're getting a little bit of a hint as to why so many other treatments fail, because we don't consider the dynamic system within which the shoulder operates. Now, you might be asking yourself, is this really the right place for me to be tonight? Well, if you're asking questions like this, you know, is it going to continue to get worse? Am I going to depend more and more on others as time goes by? I hear that so often. People will tell me if they recollect how they've gotten to where they are, they'll say, well, at the start, it wasn't too bad. I had some pain, but it was manageable. It wasn't there all the time. I didn't want to be a squeaky wheel, and so I just kept going. But unfortunately, over time, it's becoming worse. It's becoming more frequent. More intense, longer in duration. And now I'm not doing what I used to be able to do. I'm avoiding things. and I'm afraid I'm going to eventually not be able to use my arm hardly at all, and that'll make me more dependent upon others. If those are concerns you're having, this is a great place for you to be tonight. If you are hoping to get enough relief of your discomfort to get a good night's sleep, this is a great place for you to be. Nighttime pain can be a problem for some people with shoulder pain, and we're going to talk about this, why that's the case in a little bit. One of the truths we're going to speak about tonight is the reality that we influence those closest to us, for better or worse, and we're influenced by those closest to us as well. And we're in pain. It's hard to be a good and positive influence on those around us. We're going to talk about that in the context of our shoulder as well. Your shoulder is a part of a dynamic system, something that I mentioned just a little bit ago. And like us, it influences the things around it, and your shoulder is also influenced by the things around it, the environment that we operate in. Even more significantly, its environment is the closest neighbors around the shoulder. We're going to talk a lot about the closest neighbors, and I will tell you right now, the closest neighbors, not the shoulder, but around the shoulder, are the things that are most often ignored, and that's why people have shoulder pain that continues and progressively worsens. If you just want to take better care of yourself and your family, if you're desiring to avoid high-risk procedures. What do I mean by high-risk procedures? Well, surgery, that's a high-risk procedure. And if you know you could do that surgery and everything would be A-okay, you'd probably say, great, let's do it. Unfortunately, I've been around long enough to know that I've worked with a lot of people, in fact, who have said, man, I thought that shoulder surgery was going to be the answer, but it wasn't. And that's because it wasn't the problem that caused the shoulder issue in the first place wasn't remedied by a shoulder surgery. Some of the damage might have been cleaned up, but the problem that brought about that damage was not corrected. We're going to talk about that tonight. This is a good place for you to be if you're hoping to avoid those high-risk procedures, or even if you've already had a surgery and say, but I'm still having problems. Medications can be helpful, but they also have side effects that we don't desire. In fact, opiates, which become really popular for pain relief, can have really, really bad side effects. Ultimately, most people come here, though, because they want to move better, move more comfortably. So if you're in that category, this is for you. Now, this workshop is not for everyone. I get some people who show up to this workshop because their spouse kept elbowing them and saying, you got to go hear that guy talk. If you are not in the mental space to hear this information, it may not be the right information for you, and that's okay. I've learned over 25 years that I can only help people that are willing to help themselves, and so you have to be at a spot where you're willing to do something to benefit yourself. And if you're not there, we're happy to help you when you get there, and it might be better in the future for you. I wish I could tell you that I'm going to tell you something that at the snap of the finger is going to make your shoulder pain disappear forever. There is no quick fix to these types of musculoskeletal issue. If you go online and search solutions to shoulder pain, excuse me, you're going to find that there's a multi-billion-dollar industry that likes to sell you stuff in hopes and with promises that it's going to be the cure-all solution for you. There's no salve, there's no lotion, there's no one simple exercise, there's no one procedure that is going to just quickly make this go away. That's the bad news. The good news is it isn't difficult. It takes a little bit of effort over time. Doing the right thing at the right time, treating the whole, not just the individual part, can lead to significant and long-lasting changes, but it's not a snap-your-fingers solution. So if you're looking for the quick fix, I'm not going to give you that tonight. This workshop is not for you. If you're of the mindset that, man, I know I just need surgery, just let me get that surgery, that's the solution for me, it's okay to think that way, but we're going to kind of counter that claim tonight significantly. Now, here's the time for you to get involved just a little bit. I want a little feedback from you. So click on that chat button. I want you to answer this question for me. Is there a specific activity that you've noticed over the last few weeks? If I do that, I know my shoulder is going to hurt. So tell me what that is. Click on that chat button and just type in there what activities are problematic for you with regard to your shoulder pain. Your answer to that question will help me understand if what I'm going to tell you tonight is going to be beneficial for you. Now, there's a couple other questions too. I'd like to know, how bad does that pain get on the 1 to 10 scale? There's no 15 out of 10 pain. 10 out of 10 is the worst imaginable pain that you can experience. How bad does it get at its worst, even if it's only temporary? And then finally, how long have you been dealing with? Has this issue been weeks? Has it been months? Has it been years? Now, how bad it gets and how long you've dealt with it, that doesn't tell me if what I'm going to teach you tonight is going to be beneficial for you, but it might determine the timeline of benefit to some degree. The real question that I need to know is, what activity bothers you? So I see some comments coming in. Prita says, sorry if I butchered that name, but Prita says, trying to reach far in a drawer. So outstretching that arm. So yes, reaching is a task that for many people with shoulder problems is difficult. That creates leverage on the muscles that are supporting your shoulder. And so it makes those shoulder support mechanisms work more. Prita says that she rates it as an 8 at the worst, and it's been there for 5 months. So that's kind of good news, bad news. 5 months actually is not the longest in the world, even though it can seem like a long time if you've been dealing with shoulder pain. But I've worked with people who've been dealing with this for decades, and those people still get benefit when you look at the big picture with regard to this. Now, the 8 out of 10 pain indicates that it's pretty irritated. So it might take just a little time, but it's usually something that's very helpable. So very good. The reason I asked the question, do you have something that you do that contributes to your pain? It's because I know this. Oh, Kurt, I'm sorry, you're reaching over the head. So sometimes it's reaching out in front, sometimes it's reaching up. A 5 out of 10, already 2 rotator cuff surgeries. Okay, so you've been through that gamut to some degree, and that's okay. Left and right shoulder, for 1 to each shoulder. Courtney's talking about vigorous cleaning, so using force through the arm is what I'm imagining with that. For the past 3 or 4 years, maybe an 8. Kathy, reaching for things, raising the arms up to 90 degrees. Raising the arm up to 90 degrees. I got a message come through that made me think I was getting logged out here, but so far I'm still going. Past 2 or 3 months, Kathy says it's been getting worse, and it had frozen shoulder years ago. We're not going to talk specifically about frozen shoulder, but thankfully that's a very treatable condition. Taria, there we go. Hopefully I got that wrong, right? Or Paul maybe is the first name, but washing windows. So again, reaching, outstretched arms, some force, high into cupboards, come and gone for quite a few years. Well, good. At least it's not there constantly for you. Excellent. Thank you, folks, for that feedback. The reason I asked the question is that if there's something that brings it on, it tells us something about your issue. And we know that if your pain is reproducible, when you do something, if it's reproducible, it's also, hold on, so reducible. Got it to work there. If your pain can be reproduced, it can also be reduced. And I put 3 things, the 3 most common things people tell me contribute to the shoulder pain: reaching, which many of you already mentioned tonight, lifting, and then laying down, sleeping. And I told you we'd talk about that a little bit too. Now, I want you to learn just a little bit about trauma. Think about the word trauma. What conjures in your mind when you hear the word trauma? Most people hear trauma and they think motor vehicle accidents, maybe a fall from a height, a fractured bone. All those things are traumatic for sure. But there's a difference between some types of trauma and other types of trauma. What I just described, the thing that naturally comes to our brains when we hear the word trauma, is actually what we consider acute trauma. And if we graphed acute trauma, this is what it looks like: sudden tissue damage followed by time where the tissue goes through a natural healing process. And in many cases, most cases actually, when we have some tissue injury from a single traumatic event, it improves to the point where it gets below that symptom threshold line and it feels quite a bit better. That's a reality. We see people in our clinic that have had acute traumatic shoulder injuries, but it's not near as common as the other category of trauma, cumulative trauma. Cumulative trauma, unlike acute trauma, is not due to one single traumatic event. It's due to repeated micro traumas. And so the graph looks different. It's not sudden tissue damage, it's gradual changes to that tissue over time. And you're seeing on my graph there's something that could take months, if not years, to develop. In the early stages, when it's slowly climbing but still below the symptom threshold, we don't even know it's there because we don't yet feel it. Issues are changing, but we're not cognizant of it. Now, when we finally get above that symptom threshold, that's when we start to feel something. It aches, but at that stage, people will say, it's not that bad. I can deal with it. It's not so frequent. It's not so intense. It's not long in duration. So we just keep doing the same thing, and eventually it gets worse in most cases to the point where frequency, intensity, and duration becomes more significant. That's when people are seeking help. Now you see my two buckets there, one with the bucket of water overflowing, and then at the bottom, not much water in the bucket. This is a great analogy to help you kind of understand what happens with this gradual, progressive, cumulative trauma process. It is slow and insidious, but it is very predictable. With any kind of cumulative trauma, the first sign that our bodies are changing is fatigue. Okay, so I'm 50 years old. I've been a physical therapist half my life. Physical therapy is not physically demanding in most cases. So I've not worked near as hard, put as much stress on my body as some people with different types of work activities. That being said, at 50 years old, I have more fatigue than I did when I was 25 and a new physical therapist. I need more rest at the end of the week. Each night, I need more rest. That's the reality because my body is changing, and our shoulders can be the same way. The first thing we notice is, man, I can't paint as long as I used to. I got to give it some rest. It gets fatigued. It's not what it used to be. And we know we're not meant to last forever. No one has. And we kind of consider this normal. In most cases, when we experience any kind of fatigue-related issues, we just write it off as normal and typical. Expected. Okay, so we just keep doing the same things, and more cumulative issues build, more water fills the bucket, and as we get more water, now these symptoms, these warning signs, these things that tell us our body is changing, they get a little bit more significant. And so instead of just having fatigue, now we're starting to experience a little bit of discomfort. Okay, that's when people say, I feel a little stiff, I feel a little sore. It doesn't feel like it used to. It just isn't quite right. Okay, these are people that say, it takes me a little longer to get my body going until I feel like I'm moving pretty well, and definitely need more rest and recovery after doing heavier tasks. Again, most people at that point don't do anything about it. They continue to just live life, ignore this little problem that's getting a little worse, but still manageable, and more water fills the bucket. And then eventually people say, ooh, that really hurts. That's not just stiffness and soreness, that's pain. This is the time when most people usually raise their hand and say, boy, I'm not sure I can deal with this. It's not like it used to be, it's worse. Next step, when we start to have spillage occurring, that's significant tissue injury. That's stuff that's going to take more time. So I guess it's good news that this discomfort and pain usually is prior to the point of more significant tissue injury. Our goal, though, is to do what we can to move you that direction where you have less water in your bucket, not a spillage occurring. That's the cumulative trauma pathway. And that's the path that likely most of you have been on for some time. Okay? I've said many times already tonight, the key findings with cumulative issues on this path are the significance of those symptoms. How frequent, how intense, how long in duration. Okay, so look at my train tracks there. Look down the horizon. See, you got a train rounding the bend coming your way on my screen there. If we were really on this track, we'd start to hear the whistle blowing and feel a little rattling underneath our feet. We'd be getting more warning signs that this is going on. And what happens in our bodies when we start to get these warning signs is we pull back. We do less. We try to muscle our way through it or just pull back and do less and less. And unfortunately, when we have more pain and therefore choose less movement, that can have a bigger impact than just shoulder-related issues. What do I mean by that? What we're talking about tonight is very pertinent to your shoulder, but your general health is also something to be considered here. In America, 86% of our healthcare dollars are spent on 6 different categories of problems. Of those 6, 5 of them are directly related to how well and how often we move. The single greatest cost in the American healthcare system is musculoskeletal issues. Shoulder pain is part of that. It is easily the most significant cost, and it's going up all the time. Number 2, heart disease. Number 3, I'm going to skip. Number 4 goes to diabetes. 5 is obesity. 6 is depression. All of those things are positively impacted by moving well and moving often. For better or worse, movement will impact our issues related to those conditions. The one that I skipped, number 3, is cancer. Most cancers are not directly impacted by that, although some can be there too. My point is this: if we don't move well because of a musculoskeletal issue, if we don't move often because of a musculoskeletal issue, that can lead to much bigger issues than just a musculoskeletal issue. And we see that happening in America. All of those issues, heart disease, diabetes, obesity, and depression, are cumulative issues as well. Now, let me walk you through this. This is human nature I want to talk about a little bit. Most people, when they have a problem, at the start, will ignore it because it's not that big of a deal, right? Think about this cumulative process. It hurts a little, but it's not bad. It's not there all the time. I'm just going to keep going. I don't want to be a baby. I don't want to be a squeaky wheel, right? We ignore it. And eventually that can lead to bigger problems. I'm sitting in the newer section of a house that was built in 1950. And the section I'm in was built 25 years ago. We moved in 7-8 years ago this summer, I think. Yeah, when it was 100 years old, 2015, so 7 years ago. We had the insurance company come over because we were going to get it covered, of course. And they told us, yeah, we'll cover you except for those shingles. They're bad. You need to replace them. Let us know when you've replaced them and we'll put them on your plan too. Well, guess what? It's a pretty big old home and I didn't want to spend any money. And I looked around and saw, you know what? Everything looks good on the ceiling. I'm not going to deal with it. I'm going to ignore it. Now, I'm happy to say that last spring, I spent money on it before it became a bigger problem. If I had continued to ignore that issue, instead of spending the thousands of dollars I did to replace the shingles and the rubber on a flat surface, it could have been significantly more expensive because something was happening underneath the surface unless I fixed the problem. Now, with a shoulder issue, you can ignore it for a while, these cumulative problems, but eventually it gets bad enough, like I said earlier, that you can't ignore it anymore. You're no longer in the ignoring it phase because you're listening to me tonight. The problem is most of our first responses to doing something about it are not real problem solutions. They're just ways to alter or mask the issue. Okay, in fact, even in the medical world, most of the things that we do most often, medications, injections, and surgeries, do not fix the problem, they alter the problem. They don't get to the root of the problem. So tonight we're talking about getting to the root of the problem, solving the problem at its foundation. Unless you get to the root of the problem, unless you find and fix the foundational issue, you are probably masking it and covering it up, and therefore spending money on things that are most likely to be temporary symptom reducers, not problem solvers. In order to understand this, you need to understand this key point. I alluded to it before I started the recording tonight. Even though it sounds counterintuitive, these musculoskeletal issues are not medical problems, they're mechanical issues. Okay, what do I mean by that? Well, let me talk about it this way. When we hurt, we're tempted to pop a pill, right? That's what we've been taught since we were little kids. Take an ibuprofen, take an Aleve, take a Tylenol, get an anti-inflammatory of some sort, go see a doctor, get a medication. And while those can make us feel better, the problem exists not because of a medical issue. It's a mechanical problem. There's something putting stress on that tissue. And unless you take the stress off the tissue, anything you're doing medicinally is just covering up a symptom, but not reducing the mechanical stress. So you can't successfully treat a biomechanical issue with a biochemistry treatment. It just doesn't work that way. This is a movement-based issue that needs a movement-based solution from a movement-based expert. That's what I am. So I also want you to understand this without going too deep in the weeds with this. When you hear that you've got something that's inflamed, what is your natural reaction? Okay, I'm no different than you. My natural reaction is if it's inflamed, I need to take an anti-inflammatory, right? Well, I want to tell you a little bit about the natural healing process. There are 4 phases to it. You can see phase 2 there. What's that called? That's called inflammation. So first and foremost, I want you to understand inflammation is normal and necessary. During the inflammation phase, which is day 3 to about the end of week 3, the body is beginning to develop a matrix of tissues that will lead to blood vessel growth that when they proliferate and mature, provides blood and all the nutrients to that tissue for long-term health. Okay, so if we take an anti-inflammatory, we are stunting the healing process. That fledgling vasculature, the early phase of that doesn't proliferate, doesn't mature, and that tissue is left starving for nutrients. And tissues that don't get nutrients are not healthy tissues, which is why this tissue is more prone to problems as time goes by, unless we give the tissue what it needs, the nutrients it needs for health. Okay, so I will tell you that it is true that anti-inflammatories can make us feel better, but it stunts a natural healing process that can ultimately be fool's gold. It doesn't allow us to truly experience healing so that that tissue can function the way it's supposed to. And if you think you can't do anything about this, I want to tell you a story about a guy that I got to know when I was a young physical therapist in Eastern Iowa. His name was John. When he came to see me, and this was literally over 20 years ago, he was 92 years old. He was still living home alone. He was a widower. Nice guy. He had shoulder problems, though. He couldn't get hardly to the top of his head and fix his hair. Getting into the cupboard to reach things was difficult for him. He had seen doctors, had medications, eventually had an MRI done, was told, you have a massive rotator cuff tear, not a small one, a huge one. And they said, normally what we do is we maybe try to surgically repair that, but you're old. I don't want to put you under at this stage. And he's like, I don't want the surgery. I don't want that. This was before the days where people had total shoulder arthroplasties. So a lot of people in this condition would get a total shoulder replacement at this point. He didn't have that as an option. And so he just comes to me and says, man, I just want to feel better. And I want to be able to fix my hair and get my dishes out. Many people in this situation, this progressive problem, would be dealing with anxiety, depression, really common. He wasn't, and that was good on him. He had a great attitude. And he's like, I just want to function better. And so I was a young physical therapist and did an assessment, and I was optimistic, but also realistic. And I told him, I can't make that rotator cuff better, but there's a lot of things we can do to make everything around that work well. And we noticed that, like many older people, he had limitations of motion in areas surrounding his shoulder joint. He had poor thoracic and trunk mobility. He had weakness in muscles in the back of his shoulder blade that support the movement of the shoulder. All those things could be fixed, even though the rotator cuff itself couldn't be fixed. And lo and behold, a little bit to my surprise, actually, at the time, since I was a young, inexperienced physical therapist, he worked for about 6 or 7 weeks, and he got to the point where his pain was improved by about 80 or 90%. He was reaching into the cupboards, fixing his hair, and he was pleased as punch. If 92-year-old John can do this 25 years ago, you can do it too. I can tell you this. So let's talk about the most common types of shoulder pain, which will lead into those causes. To talk about the causes of the shoulder pain, the mechanical causes is what we're going to talk about before we talk about how do we successfully treat that. I want to show you what this shoulder looks like. This is showing you kind of bones, cartilage, one muscle of the rotator cuff and some of the ligaments. When we have shoulder issues, most often it's in the area where the arm bone meets the shoulder blade. It's called the glenohumeral joint, and just above that joint, underneath the bone up there called the acromion, which is an extension from the backside of the shoulder blade, and a ligament that runs between two bones of the shoulder blade. We're talking about the subacromial space where we've got a major rotator cuff tendon called the supraspinatus. We've got a bursa in there, a fluid-filled sac that's kind of a shock absorber. That's where most people's shoulder issues originate in terms of the painful tissues and the damage, the progressive cumulative damage that takes place. Okay, your shoulder, like every other body part, moves three-dimensionally. So it's going to move up and down in front, up and down inside. It's going to rotate in and out. It's a three-dimensional mover. And all the parts that connect to these structures are responsible for making that three-dimensional movement happening. We've got 4 bones that make up the shoulder. Your upper arm bone, called the humerus, the shoulder blade, your collarbone, and even your sternum is a part of the shoulder complex. There are actually 4 joints that make up the shoulder. Every one of those bones that connect to each other have a joint, and that shoulder motion is occurring because of movement in and through all those joints. It's kind of a story of 4s here, isn't it? I talked about 4 rotator cuff muscles. The most important one is that one that runs through the subacromial space, that supraspinatus tendon. Okay, there are others as well that can be involved. The supraspinatus is involved in a great majority of shoulder-related problems. Okay, and that last bullet point is really important. The shoulder depends upon a lot of other body parts to help it move efficiently. It doesn't exist in a vacuum. It's influenced by the stuff around it, just like you are influenced by things and people around you. Your shoulder depends upon this symphony of movement that's beyond just the shoulder proper. Let's talk about shoulder pain now. And again, these are just diagnoses or descriptions. We're going to talk about arthritis, osteoarthritis, joint space narrowing, bone on bone. Those all refer to the same thing. We're going to talk about impingement, and we're going to talk about rotator cuff issues. Here's a little nugget of truth, though. In very many cases, all these things kind of overlap each other, okay? Impingement, which is pinching of these tissues, can lead to changes to the bones, osteoarthritis, and changes to the soft tissue, rotator cuff related issues. And so though there can be 3 different types of shoulder pain, they often are a part of the progression or evolution of this process. See my dog there? Say hi, Zeke. Hey. 140-pound Great Pyrenean, and he likes to bark at leaves that roll by the door that shouldn't be there. Let's talk a little bit about osteoarthritis. Sorry for the distraction. Osteoarthritis literally means, well, let's go through it. Osteo is bone, arth is joint, itis is inflammation. So it's inflammation of where 2 bones come together and make a joint inflammation. But we also hear different medical professionals talk about this when they say things like, well, you got a loss of cartilage, your joint space is starting to narrow, you have bone on bone, we see bone spurs in there. Those are all different descriptions and synonyms for osteoarthritis. Now, if you've been told you have cartilage damage in your shoulder, I'm going to tell you, welcome to the club. It happens to almost everyone. Most people that have arthritis and cartilage issues and those kind of things don't know it because they don't have pain and therefore haven't had a diagnostic test. So it's not a death sentence if you've had a diagnostic test and been told you have arthritis. It's as normal as wrinkles on the skin. It's a normal part of the aging process. I think it's also important to know that cartilage itself is aneural. It doesn't have nerves, so it in and of itself cannot be the source of pain. You can find evidence of stuff that's wearing out because of mechanical stresses on that tissue and other inflammatory issues, honestly. But that tissue itself isn't going to give you many symptoms because that tissue doesn't have nerves. Okay, so that's osteoarthritis. Now, like I said, impingement can lead to arthritis. And so let's talk a little bit about impingement. This is another view of the subacromial space. This is a cross section of that acromion bone of your shoulder blade and the upper arm bone called the humerus. When we raise our arm, that ball is supposed to spin on the socket there. That leaves a little space for the supraspinatus tendon that runs through and connects. Below there's the bursa in there. That's all well and good. But sometimes there are movement issues that instead of causing that shoulder to rotate ball on socket, starts to elevate and pinch those subacromial space contents. And so that's all fine for a while, but eventually enough of that mechanical stress, and there's an inflammatory response. And if that continues, there's the cumulative wear and tear that we described earlier with the bucket analogy. Okay. Now, impingement is occurring because there's more pressure on those tissues in the subacromial space. That space is narrowing. Okay, and that creates a compressive force, which leads to friction and an inflammatory response. Will you feel better if you take an anti-inflammatory? Very likely. Again, we need inflammation though to feed. It's a normal and natural part of the typical and required healing process that we're created with. Impingement can't be really seen easily on diagnostic tests, but it's really, really treatable if you understand the dynamic motion that the shoulder needs to go through. And a lot of people have shoulder surgery for these kind of issues, and those surgeries haven't been proven to be very successful because the surgery doesn't fix the movement issue. This is the most common reason people experience nighttime or pain lying down. Inflammatory response increases sometimes when we stop moving, and it fills that space and creates more space. And that area, the subacromial space, is not very big to begin with. When we lay down, we actually lose some of that space. Standing up and gravity pulling that arm down actually opens up the acromial space a little bit more, reducing mechanical stress on the subacromial space contents. It's really easy to do an impingement test. If you put your thumb up and do a straight arm raise, eventually that will kind of hurt at a certain phase. But if you go thumb down and do that same arm raise, it's probably going to pinch more quickly. That's just a simple test. We use it in the clinic all the time. It's an indication that there's some mechanical stress on those structures moving through the subacromial space. Now, I do want to point out that pressure on tissues is normal, and the body is made to absorb those stresses. But stress is a good thing in the right dosage. Okay. Good amounts of stress lead to tissues making accommodations and changes and getting stronger. The problem exists when it's too much stress over too long a period of time. That's when the cumulative wear and tear process is allowed to progress gradually, cumulatively. We've talked about osteoarthritis. We've talked about impingement. Now let's talk about what happens when that rotator cuff starts to have issues. You can see on the left side here, we're starting to see some inflammation, which can be caused by an impingement-related problem, right? Or maybe the inflammation creates an inflammatory response, a swelling response that then leads to impingement. That's possible as well. Sometimes we don't know which is the chicken and which is the egg in this case, but we do know that if there's more mechanical stress over time, it's likely that that's going to lead to some eventual wear and tear of the tendon itself. In this particular area, there's a section of the supraspinatus tendon called the zone of avascularity. Tendons, by their very nature, don't get good blood flow naturally. But this particular section, the zone of avascularity, has even less than normal. So it's much more prone to cumulative wear and tear and eventual tearing. Okay. Now, here's also good news. A lot of people have at least a partial rotator cuff tear and don't even know it because they are functioning and feeling just fine. It can be a normal part of the aging process as well. In fact, here's some research. There's a study done that showed that if you're 60 years of age or older and have no shoulder pain, an MRI is going to show that 54% of you have a rotator cuff tear. okay? And if you're under 60, 34%. If you have rotator cuff issues after the age of 35, it's usually a cumulative process, and it's not uncommon to find some degree of rotator cuff tearing. The goal is still to take pressure off that tissue, mechanical stress off that tissue, which does not necessarily require surgical intervention. There's actually a research study done 5 or 10 years ago, and it was called the sham shoulder surgery. This has been replicated in other body parts as well. What they did is they had done a diagnostic test and found that they had some rotator cuff damage. Half the people had a scope introduced and they didn't do anything. The other half had a scope introduced and they tried to clean it up. Okay. And they found that the outcomes after sham surgery were no different than the actual surgery. There was no difference in outcomes. So the point is this. You can be told very objectively, based upon a diagnostic test like an MRI, that you have problems. And yes, tissue damage exists. But the reality is, most people that have tissue damage don't know it because they haven't had the diagnostic test to prove it. And they haven't had the diagnostic test to prove it because they don't have discomfort. They don't have pain. So my point is this, and this is true at the knee and at the hip and at the shoulder and at the neck and at the ankle, all over, all joints will show this. Asymptomatic people have evidence of age-related changes that we consider normal, even to the point of tissue damage. But pathology and pain are not necessarily directly related. Never treat a pathology. Always find the source of the pain, the reason of the pain, which is what we're going to get to next. What are the most common root causes of shoulder pain? Remember I said earlier, it's not a medical problem. It's a mechanical problem. And your shoulder, like you, is influenced by the things closest to it, its closest neighbors. And the shoulder influences its closest neighbors as well. When I talk about the true cause or causes of shoulder pain, what I'm going to tell you about is really what's the real culprit, okay? Fixing the culprit is the solution that's going to give you long-term benefit. Remember I said earlier, shoulder's made to move three-dimensionally, and every body part moves three-dimensionally, and we need to have a balance between mobility and stability. If we're out of balance with that, it's problematic. If your shoulder has too much mobility and not enough stability, that's problematic. You can have an unstable shoulder. If your shoulder is too stiff, that's the frozen shoulder thing, right? And doesn't have enough mobility, that's problematic as well. All body parts need to have a balance of mobility and stability. It's a weird word that I used, made up word called mostability, mobile stability. And so if you're having shoulder problems, we want to look and see how all these elements around the shoulder, the closest neighbors, are moving and working together, and see if there's dysfunctional movement happening anywhere along the kinetic chain. So we're going to look at shoulder blades, we're going to look at hips actually, and we're going to look at the mid-thoracic spine region and rib cage area. What about the shoulder blade? Okay, now your shoulder blade, I call it a floating bone. It doesn't have any bone-to-bone connection. It's connected via muscles to other bones, but not a direct bone-to-bone with ligament connection. And it's amazing that our shoulder blade unbelievably has 21 muscles attached to it. 21 different muscles connect to your shoulder blade, and that should give us a sign and a hint. When 21 muscles connect to something, that's an important component. Your shoulder blade is an exceptionally important component. And all these things have to work together to create a dynamic symphony of movement, a concert of motion. It's like a dance of the shoulder blade, the shoulder. Let's look at this. This is showing your shoulder blade and your upper arm and how they move together in concert or in synchrony. In order to raise the arm 180 degrees from your side to overhead, there's a portion of that motion that occurs because your rotator, your shoulder blade, your scapula is rotating, okay? That actually makes up, if you can see in the bottom right here, 60 degrees of elevation. A third of that elevation comes when your shoulder blade rotates on the floating rib cage, okay? The other 120 degrees comes from the movement of the humerus, the upper arm bone. Together, they can move. And if they do that well, they're kind of dancing with each other, which maintains space in the subacromial region. Okay, I want to show you this. This is a computer automated movement design. And it's going to show the shoulder move in a variety of ways. And I'll kind of walk you through it, talk you through it. What I want you to look at is what's happening in the subacromial region between the upper arm bone and this acromion bone that comes from your shoulder blade. If these things are moving together, if the dance is occurring appropriately, there's always going to be space maintained there. So the first motion, it'll go here in a moment. I think this is abduction out to the side. And look how much the shoulder blade rotates up in order for that arm to get all the way overhead. And look at the space that exists in that area. Maintaining space because these things, they're almost like they're orbiting in space together, right? Okay. Now, I think they're going to lift up in front now. Boy, this is going slower than normal. Now it's just lifting straight up to about 90 degrees. You see how that shoulder blade first is kind of retracting away from the thoracic spine? If they went higher, it would start to rotate again. But that's enabling it to maintain space between the shoulder blade and the humerus, the upper arm bone. This last motion is it's going to reach like it's reaching into the back pocket, extending. And now this shoulder blade continues to protraction and now retraction towards the thoracic spine itself. If that shoulder blade gets stuck, and that's most often what occurs, shoulder blade issues are not an issue where we have too much mobility. It's an issue usually where we have too much stability. All those parts that have to move that shoulder, all those muscles that have to control the rotation of that shoulder just get stuck. And when we flex our thoracic spine and that shoulder blade kind of rounds forward, it gets stuck in that position. So the question I have to ask anyone that's dealing with shoulder pain is, have you had assessed how that shoulder blade rotates? Is your shoulder blade dancing with your upper arm to take pressure, mechanical stress, off the subacromial space, the contents of that space? Usually that's because of tight shoulder blade muscles or limited thoracic spine mobility. Let's talk a moment about hips. Kind of seems weird that your hips would have an impact on your shoulder function, doesn't it? Well, think about this. I'm a baseball nut. My son's a college baseball player right now, so most weekends I'm traveling to watch him play somewhere if the weather cooperates. Think about a ball hit over the shortstop's head, a line drive, a frozen rope, as they say, and it splits the two outfielders. The left fielder and the center fielder are chasing it to the wall. The center fielder gets there first. By this time, the guy's rounding second, and he's turning on the jets to try to turn this thing into a triple. Let's imagine for a moment that the rules of baseball stated that outfielders cannot throw from their feet. They have to sit down on their buttocks. Okay, how much force are we going to get on the ball? How much momentum are we going to be able to create through our body to generate enough force to throw that ball all the way to third base and to get that guy at third? Movement of the foot goes through the knee and through the hip, and that hip turns into the motion at the thoracic spine, which engages the shoulder blade, gets the upper arm bone going so you can release that ball with the professionals 100 miles per hour plus. Okay, poor mobility, poor function, poor contributions from the hip require the shoulder to compensate. You can see the fascial connect of your right hip, the left shoulder through the front side, your right hip to the left shoulder through the back side. These fascial tissues support and connect all of these parts. And if your hip's not doing its job well, your shoulder is going to be asked to do more than it was designed to do. And it usually messes up the synchrony of motion to the point where we're going to get more stress on that. Okay, in fact, hips provide about 50% of the work that the shoulders are capable of doing. Okay, and remember, your hip is like everything else. It has to move three-dimensionally, and it has to have a balance between mobility and stability. Too much mobility in the hip is not good. Too much stability or tightness at the hip is not good as well. Thoracic spine, that's the in-between your shoulder blade and your hips, right? The thoracic spine has a rib cage connected to it. We don't move as much through the thoracic spine, but that thoracic spine movement, even though it's minor, is really, really important. And remember, that rib cage is kind of the track upon which that shoulder blade floats. And we see many people with shoulder-related issues that have a thoracic kyphosis. They're stuck in flexion, which limits what they can do with their arms and with their trunk and with their neck. And again, compensations occur in your thoracic spine leads to additional stress. In fact, the closest neighbors to the thoracic spine are the neck and shoulder above and the low back below. So if you have both low back and shoulder issues, the thoracic spine is very likely a root cause for you. The bottom line is this, folks: if you've had shoulder issues, if you've done what most people do, ignored it for a while, and then sought treatment, and the typical treatment looks like this: I'm going to go see my doctor. He's going to give me medications. Maybe it's an anti-inflammatory. It feels good for a while. When the inflammation resumes and again, when the medication wears off, we haven't fixed the mechanical problem. So we'll go back, we eventually get a diagnostic test. They tell us we have damage. We consider a specialist, maybe a surgery, maybe an injection. That's how most people deal with this, all the while still not getting the help that they need and figuring out what is the mechanical issue, or what are the mechanical issues that have led to all this functional stress on the contents of the subacromial space. So that we've talked about the types, we've talked about the causes. With what I've told you, it's going to be really simple to understand that if you want to get true, long-lasting relief, you got to find and fix the root cause. The most common treatments don't do that. Medications, injections, and surgeries only mask the problem. Successful treatment requires the following. We need to find and fix your root cause or your root causes. There could be multiple. In many cases, there are. And that means it needs to be very individualized to you, okay? There aren't rotator cuff exercises. There are exercises to fix the movement problems that are creating stress on the rotator cuff that occurs when you move. Okay, so it needs to be individualized to your specific problems. And we have to realize that the shoulder does not exist in a vacuum. It is influenced by everything around it. And so our approach needs to be whole body and true functional movement between gravity and the ground. The process is educational and empowering. Okay, I told you, it's not a snap the fingers. You have to do the right thing at the right time to get the right response. And then as your body changes, we build on that. And so that takes a little time, but the process should be one where you're learning about what to do at the right time. So you're educated and empowered to help the healing process, the natural healing process, take place. We are allowed to see multiple people at the same time and charge group therapy. I don't recommend that at all because it's not an individualized approach. So successful treatment should very much be a one-on-one experience. And we can use our hands, all that's really good, but ultimately it has to be combined with movement and exercise. Your foot has to be on the ground, because when we reach into the fridge, when we reach into the cupboard, when we reach to get the seat belt, when we lift things from the ground, it's not just a shoulder action, it's a whole body action. Remember I talked about acute, cumulative traumas, okay, those two types? Well, successful treatment recognizes that it's usually a cumulative process, but by taking the stress off the tissue, we allow the body to do what it's designed to do, get better, okay? All right, so you've learned a ton tonight. Hopefully you've nodded your head in agreement quite often. I wish I could say I solved all the world's problems in the last 45 minutes, but I haven't. We still have a few problems. You are never going to retain all this knowledge. I have to repeat it a bunch before I retain it. So our memories are limited. That's a problem. Probably a bigger problem, though, is you've heard about what the most common root causes of these shoulder issues are. You still don't know what your problem is. And we like to say that knowledge is power, but I'm here to tell you that knowledge has no power whatsoever if you can't do something with the knowledge. If you know it but don't implement it, it doesn't help you. You have to implement it. Okay. You have to have and use the tools and do it following a process to get success. So I want to offer to you this as a reward for being here tonight. I'm going to offer you a natural shoulder pain relief consultation. What in the world is that? Well, it's 20 minutes with one of our shoulder pain experts where they can apply the things that we learned tonight to you. They'll ask you some questions. They'll do some brief assessments to determine how's the hip moving? How is the thoracic spine moving? How's the shoulder blade working? Are we finding root issues here that need attention? And in 20 quick minutes, you'll know what type of shoulder pain you're dealing with. You'll know what your primary root problem areas are. And you'll be taught about what the process of making it better looks like. Now, remember, it's not a snap your fingers thing. There's a process you have to go through. But when you do a process that gets to the root of the problem, it gives you confidence. It gives you a direction, and it gives you finally something that's often lacking in this world, some hope. Okay. And so there are lots of benefits to this consultation. You can find the real problem so you're not sinking time, energy, and money into solutions that are temporary at best and aren't really solutions. You can get on the natural path of healing and avoid high-risk procedures and side effects that come from medications, and ultimately become less dependent upon others, more dependent upon yourself, feel better, and function better. That's the goal with this. Now, there is a value to this time. It would typically be $150 in the marketplace. The good news is if you sign up tonight, it's not going to cost you a thing. It's completely free. So we also want to give you a guarantee. I can't give you a money back guarantee because I'm not taking any of your money when you do this free screen. But I will say this, if you do this and say, boy, that was a waste of my time, just let us know. We love supporting nonprofit organizations like ours that transform lives and restore hope. And if you say, hey, that wasn't worth my time, tell us, and we'll give $150 to the charity of your choice. Now, we like helping those charities. We've done a lot of that over the years. No one's ever taken us up on this particular guarantee because it's not a waste of time. It's highly valuable to learn what your unique problems are so you can find the unique solutions that will work long-term for you. And so, 25 years ago when I was a younger physical therapist, I wouldn't be so bold, but you've come here tonight with a problem. You responded, registered, signed up, and listened. And I would say it would be sad to me if you got all this information and didn't say, I want to go to that next step and actually find out what my exact problems are. And, the very least, you'll have this summary that says, hey, this is what's going on. And you're going to have something you can take with you. And it says, here's the pain type. Here's the true causes, and here's what the strategy to make it better, if you would elect to do it, would go through. So in order to sign up for this tonight, the simplest thing to do is to click on the chat box again. If you click on that chat box and just say, I'm in, I want to get signed up for that free screen, I'll get you connected to one of our shoulder pain experts at a time that works really well for you. So if you want to do that right now. And I want to also know this, when you say I'm in, I need to know what clinic you want to go to. So listen close. Here are your options. We have clinics in Ames, in Des Moines. We have clinics in Newton and Colfax, Pella, Oskaloosa, and Centerville. So let me say that again. Ames, Des Moines, Newton, Colfax, Pella, Oskaloosa, Centerville. Tell us if any of those would be the most convenient location for you, and I'll forward your information. Our care coordinators in each of those locations will give you a call and find a time that really works well for you, so you can talk to me or one of my colleagues about figuring out what your real problem is. See people chiming in here. Okay, there we go. Oops, this thing's a little finicky. Courtney says, I'm in Des Moines. Yeah, that's great. Neck and back pain as well. You know what? You're in luck with that, Courtney, because when we do this assessment, just tell them you have multiple areas of pain. I do the same workshop for low back pain, and the most common true root causes of low back pain involve the thoracic spine and the hip, in addition to the ankle and the foot. So they'll look at all of those things. That would be good to know. Prita says you're in Des Moines. Sorry, Kent says Des Moines. We are We're actually in the process of moving from downtown Des Moines to 6,000 Grand, which is right on the border of West Des Moines. Next week, Monday at this time, we'll be in our new location there. So that's almost West Des Moines, Kent. So I think that would work pretty well for you. Kathy says Des Moines as well. So we'll call you Kathy. Preeta, if you could tell me which clinic you prefer. And by the way, if you're not close to one of these clinics, you still want to do it, you have the technology to do an online session because you've been listening to me tonight. We can do that in an online session. So we can do it that way too if you prefer that. Preeta says in Des Moines. Yes, very good. So it'll be our Des Moines clinic on the west side of Des Moines, just 2 blocks away from where West Des Moines starts. Preeta, if that works well for you. Easy to get to, easy to find, right on Grand Street. I promised that I would give you my personal information, and so here it is. By the way, you've gotten some emails after signing up. You can respond to any of those emails, and those eventually get to me. You're going to get another email later tonight. On that email, you're going to get a link to this video. So if you need to review it, you can do that. I would ask a favor of you, if you would, please. If you know people, most people that have shoulder pain have talked to about that problem with others that are dealing with the same problem. If you know people with shoulder pain, forward that to them so they can listen to this tonight too. The research shows that only 10% of the people that could benefit from this mechanical approach actually get to it. 1 in 10. There are 90% of people out there wasting time, money, and energy on something that's only going to give them temporary symptom relief at the best. And so that needs to change. I need your help. Please pass that along to them because there are way too many people that need help, that have simple solutions and just don't get connected to the right persons on that. So in that, you're going to have a link to that. You'll have a link to actually sign up for a screen if you want to do it that way. The easiest way is by doing the IMN thing. So we'll contact several of you on that. You can reply to that email too. This is my cell phone number. At any point in time, you can reach out to that. If you have questions, just text me or call me. At the very least, folks, I want you to see me as a resource for shoulder issues, for back issues, any musculoskeletal problem. That is our expertise. We're movement experts, and we help people every day. Our mission we've chosen to accept is transforming lives and restoring hope through movement. And all these musculoskeletal issues have a major movement component to it. We can do something about that. And I'm happy to help you and your friends with that as well. So send any questions my way. Thanks again, folks. I really, really, Preeta, you signed up and gave us some information. We'll call you to get you set up on that screen, and they'll tell us they'll tell you how to get to us. Then they'll give you a time and a location when you set that up. Oops. Stop the share. All right. Thanks again, folks. I'm honored that you chose to spend some of your time with me again tonight. Mary, you're saying that you appreciate the session. I appreciate you. Thanks for being here tonight. I'm honored that you give me some of your time, and I hope you found it valuable. Look forward to helping those of you that have spoken up here tonight too. And again, if you have any questions at any time, reach out. I'm happy to help you out any way that I possibly can. Blessings to you tonight. Enjoy the spring season. Take care.